Hello, my name is Melanie Taylor. Today I will be presenting an audio presentation of my SOAP note patient for this comprehensive clinical mock exam for nursing 5830. Today we'll be discussing AM, a 1-month-old Caucasian female. She presents to the clinic today for a scheduled well visit with her mother. The history is obtained from her mother, who is a reliable historian. The family resides here in Alexandria, Louisiana, and consists of the patient, her mother, and her 2 siblings, which is a 16-year-old sister and a 13-year-old brother. The mother is divorced, receives good support from her older children's father. She's employed as a teller at the local bank, and she's on maternity leave at this time. The pediatric care is provided by Dr. Shinagozi, and that's the biographic data. For subjective and her chief concern, she's here today for a rash for 2 weeks, which is spreading. The history of the present illness, the mother reports that this rash has been present for 2 weeks. It started in the diaper area, now it is on the right face, and has spread to the face, neck, back, and chest for the last week. The rash that's on her upper body and face does go away with a bath, but it comes back. The baby does not appear to notice the rash. She's not fussy, cranky, or irritable. She's easy to console. Mother reports using the same baby wash, and sometimes she only uses water. She dresses AM in a baby gown or onesie, keeps a blanket nearby but not on. Air conditioner is used in the home. She denies fever, fatigue, decreased appetite, decreased urination, drainage, blistering, crusting. No changes in her diet. Denies medication or antibiotic use for the child or herself. No changes in the environment. Denies detergent changes, body wash changes, diaper changes. States that the stools are loose, greenish yellow, seedy. No foul odor typically occur after breastfeeding, and she is breastfeeding on demand. AM takes 2 45-minute to 2-hour naps during the day, and she also wakes up during the night at 9:30 p.m., 3 a.m., and 5 a.m., also for feedings and diaper changes, and she's easily returned to sleep at that time without excessive crying. There's no illness in this family currently, no family members with a similar rash. For her past medical history and past social history, AM was born full-term vaginal delivery without complications or NICU stay. She was released from the hospital within 24 hours after birth. At birth, she weighed 8.5 pounds. Her height was 21 inches. She's had no hospital or ER visits since birth. She was seen twice in this office for umbilical granuloma and nodules to the breast after birth. Silver nitrate was applied for the first visit. The site was reevaluated for the second visit. Since that second visit, the umbilical stump has fallen off and the navel is intact. The breasts were also evaluated at that second visit, and the firmness was decreasing. Now for this visit, the mother states that the firmness is almost completely gone, and she has no further concerns for the umbilical granuloma or the breast firmness. AM has not received any vaccinations. The mother declines vaccinations due to adverse reaction, which resulted in complications for her oldest child. AM is 100% breastfed, and the mother did state there was 1 episode of engorgement that was relieved by continually breastfeeding on that affected breast. It improved, and there's been no other incidents. Typical meals for the mother who is exclusively breastfeeding are as follows. Breakfast would be cereal, oatmeal with whole milk or yogurt. Lunch would be a turkey sandwich with whole milk. Dinner would be whatever the kids are eating, which would be something fast like microwavable chicken, macaroni and cheese, green beans, and water. She does drink water throughout the day, denies excessive sugar or caffeine intake. Reports that AM is interacting well with siblings, turns and holds up her head when she's prone. She gurgles and coos. She turns her head in response to voices, and she responds to noises within the environment. For allergies, she denies food, latex, medication allergies. The only medication she's using right now is Boudreaux's butt paste over the counter for a moisture barrier in the diaper area. For social history, AM's mother is divorced from the older sibling's father. She's in a new relationship with AM's father. However, that relationship is strained. She does state finances are tight, but she still believes that she can meet the family's needs, and she has not applied for financial or nutritional assistance because she does not believe that she will qualify. She does receive positive support from her employer regarding breastfeeding and has been assured that she will have adequate time to pump at work when she returns. She has a supply of breast milk going in the freezer currently. The family lives in a 3-bedroom, 2-bath home. AM has her own bed in the mother's room. There is carpet in the home. There is a pet cat in the home. Stays kept clean and free of fleas. The grandmother also has 2 house dogs inside her home. AM does not attend daycare while the mother is on maternity leave, but she will be receiving care inside a family member's home once mother returns to work. That family member has one 2-year-old child. AM's sibling, the 13-year-old sibling, is a big help for mom, but he recently broke his arm and he has to have surgery. Both older siblings attend school outside of the home, and the mother has a letter from a specialist explaining that blood relatives are at risk of developing the same reaction to the vaccine that the oldest sister did. So she signed a waiver. The children can attend school. She has to pick them up during any outbreaks of illness, but neither one of them has had any major illness so far. The sister had, for family history, the oldest sister, who is 16, had a reaction to the DTaP vaccine, and it resulted in brain damage for her, acute demyelinating encephalomyelitis, mild intellectual disabilities, but she does not have any physical disabilities. There's no medical ailments or delays, developmental delays for the brother. Mother denies medical history for herself, but AM's maternal grandmother had asthma and hypertension. Maternal great-grandmother, diabetes managed with diet. Maternal grandfather died around 80 years of age due to emphysema and COPD. For review of systems, for general, she denies fever, fatigue, and fussiness. Head, denies sunken, bulging fontanelles or decreased alertness. Eyes, denies discharge, redness, swelling, changes in vision. Ears, denies discharge, swelling, redness, lesions, changing in hearing. Nose, she does report congestion. She recently purchased a humidifier. Not a lot of secretions present when she uses the bulb suction syringe. She denies sneezing, vomiting, milk through nose, cough, nasal flaring. She denies lesions in the mouth, white coating, excessive secretions, mucus, or altered latch. For cardiac, she denies discoloration, fatigue, or edema. Respiratory, she denies shortness of breath, wheezing, tiring during feeding. For integumentary, refer back to the history of present illness. Gastrointestinal, she reports occasional stomach discomfort after feeding, which is relieved by stomach massage or prone positioning. She spits up after feeding about 4 to 5 times a day. It's just a small amount. It appears the same as the formula. Sometimes it's curdled. There's no blood, no mucus, no yellow or green emesis, no forceful vomiting. It only came out of the nose one time. No excessive gas or burping. About 5 to 6 loose greenish yellow seedy stews daily, and she denies fatigue, diarrhea, constipation, or decreased appetite. For genitourinary, she reports a urination normal 5 to 6 times a day, no dark color, odor, blood, or discharge. For lymphatic, she reports that the breast buds are softer and improving, and she denies any other hard or enlarged nodes on the general body. Musculoskeletal, she reports turning and holding up head, and she denies pain with any movement of head or extremities. For vital signs, objective vital signs, heart rate is 143, oxygen is 100% on room air, temperature 97.3 axillary, her height is 21.75 inches, weight 9 pounds 13 ounces, head circumference is 37.5 centimeters. She's in the 74th percentile for her height, 61st percentile for weight, 75th percentile for her head. For my physical examination, she's pleasant, relaxed, breastfeeding attentively. Her head is midline, erect. She has moderate neck control. The anterior and posterior fontanelle are open and normal. Her eyes, the red reflexes present. Pupils equal, round, and reactive to light. She follows me with her eyes. In her ears, I see her pearly, shiny, translucent tympanic membranes. Each ear, cone of light visualized in the external ear canals are lesion-free. For the nose, there's moist pink nasal turbinates. There's no edema, no drainage. Mouth, moist pink oropharynx, no lesions, ulcers, or thrush. Cardiac, regular rate and rhythm, no murmur, no thrill, brachial and femoral pulses are 3+. Respiratory, respirations even and regular, lung sounds clear, cap refill less than 2 seconds, no cyanosis. Integumentary, there is blanching areas of macular edema to her posterior neck and scalp. The skin is intact, there's no drainage. There's also confluent maculopapular rash with erythema to her genital and perineum, genitalia and perineum, which is shiny and moist and blanching. There's no satellite lesions or bleeding there. There is mild erosion on the labia. Also, there's discrete prickly red papules to the face, cheek, neck, chest, and back. There's no crusting surrounding erythema, edema, or drainage. For her abdomen, for her gastrointestinal, her abdomen is soft, non-tender, no distension, no visible peristalsis, normal bowel sounds in all 4 quadrants. And I did observe a yellow, seedy, loose stool with no odor in her diaper during my exam. Genital urinary, no vaginal discharge, no odor. Lymphatic, slightly firm tissue still surrounding the nipples of the bilap breast. There's no redness, warmth, streaking, nipple discharge, no enlarged lymph nodes on the body. Musculoskeletal, she's scooting and attempting to hold her neck up, turn her head when she's placed prone. There's no clicking or stiffness to hips, then there's normal range of motion to those extremities. Her differential diagnoses are irritant contact dermatitis, allergic contact dermatitis, and candidiasis. Her diagnoses are irritant contact diaperdermatitis, malaria rubella, congenital non-neoplastic nevus, newborn esophageal reflux. And the plan is her next well visit will be at 2 months, and I want her to call the office in at least 2 days to discuss the progress for the rash, and I will see her in the office in 1 week to evaluate the rash, or sooner if there's any changes or concerns. I want her to apply nystatin cream to that diaper area twice daily for 5 days, and follow that nystatin with over-the-counter Desitin A and D ointment, and she can apply that ointment with every diaper change. Clean the area with a soft towel and lukewarm water to the diaper area, rinse and pat it dry. Frequent diaper changes, leave the diaper open, exposed to air as much as she can throughout the day, or she can use a hair dryer, blow dry the area with a cool setting for a few minutes. Careful not to touch the skin 3 to 4 times during the day. Avoid any lotion, powder. Use alcohol-free and unscented diapering products. Only 1 layer of clothing. Avoid any abrasive cloth to keep the skin cool and dry. Contact the office for any signs of worsening, such as bleeding, swelling, pain, pus, blistering, fever, increasing redness, or rash spreading. Monitor the reflux. She's gaining weight well, so I'll check her weight again in 1 month. For the congestion, just bulb suction to nose with saline after the spit ups. Keep her up right after feedings, and continue to use that humidifier in her room. She can contact the office if there's any signs of worsening, such as fever, decreased appetite, constipation, diarrhea, abdominal discomfort, increase in vomiting, or decrease in wet diapers. And the level of billing for this visit will be a comprehensive level of billing under E&M services. For my application of the framework for this SOAP patient, she does have several stressors right now, and she has, for interpersonal physiological, her primary stressors right now would be the breakdown in the first line of defense, which is her skin. As an infant, that is very important that that barrier is there for her, and it is some evidence that it has broken through the line of defense, and now there is action from the line of resistance, because we can see the inflammation, the signs of redness, the irritation to the skin, but it has not deteriorated too bad, because there's no weeping, there's no blistering, there's no signs of a secondary infection just yet. She also has the intrapersonal stressor under physiological of the increased risk of immune response to vaccinations, because she is a blood relative of her older sibling. But she is exhibiting appropriate weight and head and height measurements, and her body is exhibiting appropriate healing, because her umbilical granuloma has resolved. I can believe that this diaper rash will also resolve. Her mother, which is a direct contact with her, she's breastfeeding 100%. For psychological stressors, they have a